I am Dr. Marilyn Thomas. I am a social epidemiologist in the Department of Medicine, as well as the Department of Epidemiology and Biostatistics. My field of research is to study structural racism as a social determinant of health, and I'm in my first year as a faculty member at UCSF. What I get to do, because I was a postdoc for 5 years before I transitioned to faculty this year. So I get to continue my current collaborations across multiple departments with multiple researchers, but now I get to expand my network too, to include even more world-class researchers. And I also get to continue working on the SF Build project, which is the project to increase diversity in the biomedical sciences. That's a partnership between San Francisco State and UCSF. So I get to continue that collaboration as well. There is a program at UCSF that I've been co-leading called the SF Building Bridges program. And it was at the very end of a 10-year NIH grant. And we just wrapped up our last year. And the program is designed, in general, the whole initiative is designed to increase diversity in the biomedical sciences. So I had opportunity to mentor and do workshops and help rising scholars like me enter this field. Since it was in its last year, it was closing out, but it was so successful that UCSF decided to institutionalize it. I'm now the co-director of the SF Build project here. So all of it's very exciting. And so being here is important to me on a lot of levels. In the short term, in the next few years, my primary goal is to study structural racism as a social determinant, but specifically think about innovative ways to measure and estimate its direct effect on health. And why that's so important to me is because a lot of the ways, first of all, it's really difficult to measure racism in an empirical way that you can then study it in epidemiologic research. So actually what you're capturing and making sure you're capturing what you think you're capturing is very important. We can think about it in terms of policies, practices, and norms, and how we operationalize that and measure that in public health research. So I'm really going to focus on that for the next 3 years. 3 to 5 years. But in the long term at UCSF, I'm really hoping to advance structural racism research broadly throughout the institution, particularly my department, but throughout the institution. And my goal is to hopefully create some kind of ultimately like an initiative or a center in which people can come and access really high quality, valid data, in order to integrate it into their own studies, to have access to experts in the field of study like myself, to consult on projects or help inform better methods to study health equity research, and also just, building out an infrastructure where we can kind of expand our network and have spaces in order to advance the field in general. So building out a racism research lab or a center, an initiative, something like that is kind of my broader goal. My broader hope in terms of how I can impact diversity relates to just how we think about racism in general, because talking about racism is really difficult for people. A lot of things can come up, people get triggered, and I hope that in expanding this field, advancing this field and increasing diversity through the SF Build project that we're working on, we will start to understand, and this is also part of my scholarship. A lot of my scholarship is showing that racism is actually harmful for everyone, including racially advantaged groups, such that everyone will benefit from any intervention to combat it. Receiving this particular award is one of the greatest honors that I've had in my career so far. And it will allow me to not only continue to do this important work, but remember why I'm doing it.